and I learned to live in the moment a little bit more. Although I thought I had been doing it, I hadn't been doing it as well as I could. You know, I was overscheduled and overdone and trying to build a hospital and build our practice and build this foundation and build the support group. And I finally realized I had to start letting other people help and stop trying to do it all myself. So this was in the OR, and this is back in the good old days. And this was actually at DSI in Bensalem when the hospital was open. And this slide's in here because there was a time in my life where I didn't realize that I had to be in the moment as much as I needed to be in the moment. But thank God my nurses knew I needed to be in the moment, because my nurses used to put me in timeout. It might be hard for you to believe. But if I was in the operating room and I wasn't exactly where I was supposed to be at that minute, if I was thinking about something else, if I was talking about something else, if I wasn't focused on whichever one of you was in the OR completely and 100%, and I think many of you, I don't know if you remember with the Versed on board, but when you go to sleep, I'm in there holding your hand with my hand over your heart, and I'm doing that because I want you to know that I'm completely with you in that operating room. And that's the one crappy thing about Versed, is because some of you don't remember, and I almost think I should just record it and like send it to you in a little video afterwards and say, I really was here, you know, holding your hand. But there was a time when I had to be in a timeout, and my nurses were smart enough to tell me to get back in the moment and to not think I can fix all the world's problems at that time. Anybody know who this is? Christine O'Donnell is one of the people who is responsible for making my transition. Chrissy was one of my best buds at St. Mary. She was an amazing orthopedic surgeon who at the age of 42 was skiing double diamonds out in someplace in Colorado. And she called me and she said, something's not right. She says, I have a foot drop. It wasn't a disc. She wasn't having pain down her leg. And over the course of the next 6 months, Chrissy went through the process of elimination with diseases. And by August of that year, she had been diagnosed with Lou Gehrig's disease. So she's 42 with 2 beautiful kids and a great husband and a fabulous career. And she's in a wheelchair. And she can't operate. And she had a disease that was completely incurable. She had a disease where, regardless of where you went, they didn't give her hope. And Chrissy fought a really, really tough battle. She ended up with a trach so she could breathe and a feeding tube so she could eat. And she fought every single day. And the most amazing thing about Chris, and the greatest gift that she gave to me, was teaching me that as a doctor, my job was to help my patients get to a safe place, and that I don't own the cancers, I don't give them the cancers, and I can't always take it away. But that my job was to help each and every person that came into my life to heal and to get to a safe place again. And Chrissy couldn't be cured, but she did find healing. And she was an amazing spirit who became my editor and told me that I had to finish my book so that she could read it before she died. And so when your girlfriend tells you that she's going to die in April, you figure she needs some time to read it, so you got to finish it by January, because somebody had to turn the pages for her. So I finished my book in January. She read it. She lived past April and lived till the next fall. And when she passed away, she made me promise her, because she couldn't talk at the time, she blinked. And she blinked to me that I needed to publish the book. And within 2 weeks after she died, there were editors calling me asking to read the book. And so I knew that she was a little more powerful on the other side because her body was physically broken. But she didn't have cancer. She had an adversity bigger than cancer. And you guys may not believe this in this room, but cancer may not be the worst thing that ever happens in your life. But cancer can prepare you for the other things that come along down the pike. And Chrissy's greatest gift to me was teaching me about healing so that I could help you. You might recognize some other friends. Nancy Sachs, who's my Reiki master, Beth Matlack, my PA, Amy Harvey in the front. We had a pink pajama party. We were being silly. Obviously, Chrissy, me, and Lauren Laverty. For any of you that's read my book, that's Lauren right there in the center above Chris. And Lauren is fabulous and wonderful and alive. And she just got married a couple months ago. And she's pretty amazing because Lauren was diagnosed with a brain cancer almost 15 years ago. And she was told that she wasn't going to be here and that it really was one of those ones that wasn't going to do so well. But what did Lauren do? She pulled up her bootstraps, and she did her surgery, she did her chemo, she did her radiation. Because she's a doctor, she necrosed her bone flap, had to walk around without her a skull for about 6 months. Figures, we get every complication under the sun. And Lauren's gift to me was teaching me about Reiki. And for any of you that have used any of the services of the Healing Consciousness Foundation, you'll know that that was one of the things that I was able to learn through this process. Lauren is that person who introduced me to Reiki. I had no idea what it was, but she was my girlfriend. She wanted to do it. And I knew that as a general surgeon at the time, I couldn't fix her brain cancer, but I could be there with her. And sometimes just being along on the journey with someone else is all they need. They don't need you to fix them. They don't need you to tell them what to do. They just need you to be and to be with them. So here's the deal. If you're just at the beginning of this journey, you got to prioritize. And number one, you got to get a team of healthcare professionals that you know are going to work with you and be partners in your care. Get your care in a timely manner. Try not to delay things. Try not to put things off. And I love that, you know, it's very funny when people want to put off stuff. It's like it's not a nail appointment. Like, okay, this is cancer. It's not a hair appointment. It's something that you got to kind of take care of in a timely fashion. Some of you are participating in clinical trials. We're always using clinical trials to find a better way to treat this disease. The integrating therapies, healing therapies, is one of our passions and one of the reasons why the Healing Consciousness Foundation exists, because we need to be able to have a venue and an avenue to provide you with the services that we know are so valuable on your healing journey. And if any of you in the room haven't participated in them, get with it and get it going. And then you got to be prepared for the cliff. Because the cliff is that thing that happens 2 weeks after you're done treatment. And many of you have participated in those cliff moments in my office when you come in and you know you're supposed to be all smiles because your radiation's done or your chemo's done or your reconstruction's done. And some of you may not have reached your cliff yet, but now you're going to know about the cliff. Because the cliff happens and you don't even know it's coming, because while you're in treatment, while you're getting those toxic drugs and while you're getting the radiation, or while you're taking your tamoxifen and your Arimidex, and while you're seeing your doctors all the time, you feel secure because you're doing something about this disease. The cliff is when you're done with the actual treatment and you have to go back to your life. So there's a couple different ways to be on the cliff. And when I was putting this talk together for the first time, I Googled girl on cliff. And this picture popped up. And so it's funny because, like, you know, when you pull pictures off the internet, sometimes they're not as clear as you want. You know, so I was trying to find a higher resolution picture. And I could not find a higher resolution picture, nor would this stupid picture come up again when I Googled girl on cliff. And I did it again and again. And I was like, all right, God, I got the message. So the girl's supposed to be foggy as she stands on the cliff. And so this is why I tell you, like, this talk was slightly divinely orchestrated, because she's nowhere else that I could find on the internet, but she was supposed to be there, because on that cliff, you are in a fog. Because you've done everything that everybody asked of you as far as your treatment goes, and now you're standing there and you're scared. Because tomorrow, you're not going to have your chemo nurse that's coming up to check on you, and tomorrow you're not going to have, you know, Dr. Scarlett or Dr. Skalicki or Dr. Lamb taking care of you. And tomorrow you're not going to be coming back to the office for Beth Matlack to check your incision. So here's the deal. You got two ways to be on the cliff. You can hang on for dear life, or you can go for the gusto. It's your choice. Now, for those of you that hang on for dear life, that's why you come to the office, because I don't want you to slip down. That's why I try to bring you back. And you may say, well, I just went there, and I don't know why I really have to go back to the office. And so a lot of times you're not coming to the office because I need to check your incisions, I need to check your brain, and I need to check your heart. Because I need to make sure that they're kind of in alignment. Because those are the parts that run away with you. When your mind starts to race and you start to get scared again, and you felt good while they were taking care of you, but now you're scared. So this is where a survivor becomes a thriver.